been mentioning initially when you came, please tell me where was the discomfort?
So initially when I came, the pain was in my neck and it was all through the shoulder.
Yes.
So I would say that it's a lot better than then, but I'm still in pain on my neck, on the right side of my neck. And as and when, so if there is stress, the day I'm stressed about work or something, then it increases. But however, I would say that it's not going to my shoulder now. It stays here. So even now I'm in pain, but it is only to this part.
So let's break these things up. You mentioned that pain had been for many years, right?
Oh, yes. Yeah.
So that level of discomfort that when we first met, compared to that before treatment, you said that it's less. How much % less pain?
So on 10, if that was 9, then I would say right now I'm at least at 5.
Okay, 5. So it's reduced down for at least 4 points. Sure. It's reduced down.
Yeah.
Now, are you getting the pain for the same period of time as you were before, or is the frequency reduced?
No, frequency has reduced, definitely.
So compared to before, how's it before and how's it
yes,
now?
Like before, every day after work, I used to be in this kind of pain. Now I would say in a week, twice or thrice I am like this.
Okay, so it's reduced down from a constant daily occurrence to now 2 to 3 times per week.
Yes.
And what are the things that will make it come 2 to 3 times?
Definitely stress at work is the main thing which keeps, which aggravates it a lot. So right now, like I told you, it's my quarter end at work. So till tomorrow, it's a lot of stress for me. So I'm sure that it's going to stay.
And what's your nature of work? Is it computers, phones, or what are you doing?
Computer,
Writing?
mobile. Of course, we have to be all the time on the WhatsApp or even on the emails. So it's continuous work from morning till evening on the laptop or on the mobile.
So to clarify, will you start the day off then without pain, and then it will slowly come on? Or what,
no, like today I got up with the pain. So, but like past few days, sometimes it is that I don't have any pain when I get up in the morning since your treatment has started.
I see. Okay.
So before that, every day I used to be in
every
pain.
day.
Yeah.
And you've mentioned that has the location changed? The spreading of the pain?
The same.
Does it come down to the same?
No, that's what I said. That it doesn't come down to my shoulder.
Now
it stays from here till here.
Here, and whereas before it was going
down here up till here, and then sometimes even to my lower back. My lower back is a lot better, and my shoulders are fine, but this part is still bothering me.
That's the challenge at the moment. And with regards to your lower back, compared to before and now, what differences would you say?
I don't have any pain now in the lower back. Even when I'm stressed, even when I'm at work sitting all day, that's what I was even telling Rizwan, that I feel even after the whole day's work, when I'm going home, I don't have pain in my back. Only the pain stays here.
Yes. But before you had pain whereabouts?
It used to start from here, on my shoulders, on all to my lower back till here.
And now you've mentioned there's zero into that, huh?
Lower back is fine. Only it stays here.
Space of a couple of weeks, isn't it?
Yeah, I think 4 weeks.
Yeah,
4 weeks, 4 weeks and twice a week.
And you feel that this is working positive for you?
Yes.
Okay. How does this compare to other treatment methods that you've had?
Other treatments were more of, we were given painkillers. So you're having painkillers, then you're fine for that period. And then after the moment you stop the painkillers, the pain is back. So it was just a symptomatic treatment which was giving me symptomatic relief for that moment of time, but it was not.
So what do you feel is the difference with our approach? Because obviously you're committed. What is the difference?
Definitely the biggest difference is that I'm not risking my body to medication, which is giving me a lot more satisfaction that I'm not, while in the process of curing my neck and back, I'm not harming other organs of my body.
Of course.
So medication is the one thing which is bringing me here.
Tell me about what do you feel in terms of the explanations that we're given or the understanding of the body? Did you feel that?
Yeah, that is another aspect that no other doctors, like if we used to go to other doctors, they would, if you tell them about, okay, I have pain here, the x-rays were taken per se only this region, yeah. While when we came to you, that was the first good impression we had, that you took the X-ray of the entire spine, and then you explained it to us stage-wise how we are going to be improving, and then you also set the expectations right for us, that we might come back with pain on and off. We will be having those days where it's going to be increased, some of them will be fine. So the expectations were right. While when the previous doctor I was going to, every time I went to him, he told me, there's no issue, but then there is an issue, that's why I'm in pain. So then he gave me sleeping pills, he gave me to correct my sleeping habits. That did help to a certain extent, but then again, at the moment I stopped the medicines, it's the same. Yeah, so it did treat my sleeping habits as well. I'm sleeping well after that, even if I've stopped the medicine. But yeah.
And what would you say? I mean, we're still going through a process now.
Yeah.
By no means is everything fixed. Especially
time.
if we're working naturally,
Yes.
without medication.
Yeah.
These things is a process. Yeah?
Yeah.
So even though that's the case, what would you say to someone if they were unsure, if they didn't feel confident, or what would you advise that person if they had a similar issue as you?
No, it is very important that they have to have the faith that it's going to be treated with this method. That's first most important. So I'm going to explain them my situation, how whatever I have gone through, the different treatments I have gone through, and for how many years. It was not a short period. That's the reason why. Even if you told me it will take me 3 to 6 months to get fine, I'm ready to take that, because it's so many years I wasn't treated. So another 6 months is a sure bet, yeah.
And the speed of change of experience compared to
lot faster. With no medicine, it's lot faster. So what I'm liking about this treatment is that it's not a symptomatic treatment, relief for me. It's going to be a permanent treatment for us and strength to us.
Going deep into the cause of the issue. Huh?
Yes. And that's not convincing, definitely.
Well, thank you for sharing, and please keep up.
Yeah, thank you.